So today we'll be doing Kybella, and the first thing we're going to be doing is marking the area that we're going to be working on. Okay, so our wonderful patient, he's actually a great patient. He's young, great, beautiful face, but he's got a little bit of fullness right under his mandible. Put your chin down just a little bit, yeah, and you can see it right there. And that's just really fatty tissue, so that's what we're going to be working on today, okay? Kybella works by dissolving the fat, killing those fat cells. Takes about 2 or 3 treatments to really see full effect, and we'll do those treatments every 4 to 6 weeks, okay? So the main thing that we need to worry about here is making sure that we're marking the area that we're working on so that we have the correct positioning for the injection, okay? So first things first, I always mark the midline. Just keep your head straight. We're gonna mark the midline, okay? And then I'm gonna mark the angle of his mandible here. There. And then I'm also going to mark his anterior border of the sternocleidomastoid muscle, which is right around there. Good, so that's kind of the area that you're working on. And of course, we're working on this fat, so we're not going to go all the way down here, but those are the most posterior border that you're going to be working on, okay? And then once you mark the mandible, you mark about 1 centimeter below that as your safety zone. So you don't want to go anywhere beyond this line here, because that's where you're going to get into trouble with the meridianomandibular nerve. Okay. Great. And chin down again. And so he's kind of got diffuse adipose tissue. So our main area of concern is sort of, oh, my pencil's going away. It's kind of right around here. So I'm not going to worry so much about out here. He doesn't have a lot of fat there. Most of the bulk of the fat is going to be there. Sorry if I'm scratching you. Okay, so most of the bulk of the injection is going to be around here, and then just peripherally, if we have a little bit, we'll just do a smaller injection peripherally just to kind of feather it out, okay? Okay, so now we're going to just be numbing the area with a little bit of lidocaine to help with a little bit of that pain of the injection. Okay, Fabio? So I just finished infiltrating him with local anesthesia, and now we're applying the tattoo that's going to have our markings for where we're going to be injecting the Kybella. There's your marking. So that's the grid. It has different dots about a centimeter apart. That's going to show us where we're going to be injecting today. Okay. Each patient is different depending on the distribution of the fat, as well as how much fat there's present. Okay. So each dot is going to tell me where I'll be injecting. You inject about 0.2 cc's of Kybella per little dot, okay? So you shouldn't feel this, Fabio. If you do, just let me know. I'll slow down, okay? So it's a fairly simple procedure. We're really just injecting the chemical. You let the effect kick in. And you're not feeling any pain, right, Fabio? Mm-hmm. Excellent. We did use lidocaine on him. You don't have to use lidocaine all the time. But just for patient comfort, he chose to have it, which is totally fine. You can have it. Okay, so when I come to the edges, I just kind of feather out so you don't use all the full dose. You just kind of feather it out as you go. This also works great for off-label, of course. Love handles, any extra fat or fatty tissue, especially here in women. You can inject off-label in those areas. And it works great. Again, you do get to expect some swelling after the procedure, which lasts from 2 to 4 weeks, sometimes a little less, sometimes a little more. It does work wonders, and this is considered not temporary, but actually permanent treatment of this fatty tissue, because it actually literally explodes the cells. Okay, so we're done injecting him. We've basically injected a pretty large area. He really did have a lot of fatty tissue in a large area here. So we used about 2.5 vials of Kybella. What to expect after the injection? Not a lot of black and blue, as much as really just swelling, because again, that medication is attacking those fatty cells and really destroying them. So in about 4 or 6 weeks, we're going to reassess and see how you responded and see if you need a second treatment. Most people will need 2 to 3 treatments to get that full effect. And again, it just depends on how much how much fatty tissue you have there that you'll need the second treatment. So for this month, you may have to wear turtlenecks because you really do get a little bit swollen in the neck. You'll have that exaggerated submental fat, or the papada as we call it. Okay? So I'll just, if there's pain, which there shouldn't be, just take Tylenol. You can take anti-inflammatories and see if that makes a little bit better on the inflammation or the pain. But otherwise, there's nothing to do, just wait. If there's inflammation, that means it's working.
Okay.
Okay? Perfect, thank you.